Hi, I'm Mel and I'm here today to tell you about the clinical skill of removal of catheter, okay? So this is one of the clinical skills you'll get in your NMC OSCE test. Now, I don't know if any of you know this, we used to follow the Royal Marsden step-by-step list for removing the catheter. Now we don't, the test centres have a different protocol and this is the protocol that we'll be using today and I'll be demonstrating, okay? So we're just going to start the station as you would if you were doing an OSCE. So before I start, I'm going to gel my hands, palm to palm, backs of hands, fingers interlaced, fingers interlocked, tips of fingers, rotational rubbing of thumbs, rotational rubbing of wrists, sorry. Okay, so I'm just going to confirm with the examiner. Examiner, can I confirm that my patient has had a 3-way ID check, allergy status confirmed, and they've given informed consent for this procedure?
Yes.
Brilliant. Now I can start on preparing all my equipment, okay. So I've got a trolley here. This isn't a clinical procedure that you need to be completely sterile for. So I'm just going to presume that this trolley has been cleaned with soap and water in the last 24 hours. I'm now going to don an apron. So we use aprons in OSCEs as PPE to make sure that we keep our uniforms clean and stop microbes or bodily fluids that we can be exposed to, contaminating our uniform. And it also protects the patient from the microbes we have on our uniform. So it's very important to wear an apron. I'm also going to gel my hands. Palm to palm, backs of hands, fingers interlaced, fingers interlocked, rotational rubbing of thumbs, tips of fingers, rotational rubbing of wrists, okay? The equipment I'm going to need are as follows. I'm going to need a tray, okay? I presume this is washed with soap and water in the last 24 hours. I'm going to use a Clinell wipe to clean the tray. This is 70% alcohol wipe. So I'm going to clean it in a zigzag-like manner, doing the sides of the tray last. I'm now going to clean under the tray. Okay, and I'm going to allow this to air dry on the trolley. Okay, so while that's air drying, I'll gather the other equipment that I'll need. So I'm going to need a 10mm syringe. So this is intact and it's in date. And I'm going to use this syringe to aspirate the balloon so I can remove the catheter. Okay, so it's intact and it's in date. I'm going to put it in my little tray. I'm going to take some hand gel with me because we'll have to change my gloves probably during this procedure. And I'll need to gel my hands whenever I put on or remove gloves. I'm going to take some gloves with me, the right size for me. I'm also going to take an Inco pad, okay? This is an incontinence sheet or Inco pad, you might have heard of it called. This is just to go under the patient, so when I remove my catheter, I can make sure that her sheet doesn't get dirty, okay? I'm going to put this under the trolley. Now I have all the items that I need, I'm going to return to my patient and start the procedure.